Hi everyone. I will perform head to toe assessment today. So before anything else, I'm gonna show you my ID, my BBC ID. So my name is IB Luzon Das Cabrelius. Then the back of my ID is the student number is 282292. Then I'm wearing my complete uniform and I'm gonna wash my hands or sanitize my hands. I do have here my stethoscope, my pin light, at the same time the alcohol swab that I will use this one to clean my stuff. So I'm gonna clean up now the pin light and also the diaphragm of my stethoscope and then the bell as well. So now I am ready to perform the head to toe assessment. So I'm going now to the room of the patient. So I'm gonna knock. Knock knock. Hi sir, good afternoon.
Good afternoon, ma'am.
My name is Ivy. So I'm here to do a head to toe assessment on you. The
Okay.
purpose of this is to get some informations or data to help us to make your plan of care on you.
Okay.
Okay, sir, is it okay to proceed?
Yes, ma'am, please. Thank
Okay.
you.
Okay. Could you state your last name and your first name, please?
My name is Gabrielius Roger,
Okay. Can you tell me your date of birth?
November 30, 1973.
All right, so I'm gonna make it sure that to provide the patient's privacy. If there's a curtain, I'm gonna close, and then I'm gonna drape the patients, especially when he is lying down. All right,
Okay.
so sir, I saw your chart. I read your charts. So that you are in pain. So are you having in pain right now?
Yes, ma'am.
Okay. So where is your pain?
Here in my stomach.
Okay. So is your pain increasing when you move?
No.
Okay, so can you describe your pain? Is it sharp? It is burning pain?
It's sharp pain, ma'am.
Okay, is it sharp? All right. Okay, so is it radiating from from your stomach going to the other parts of the body? Is it
No, only my stomach is here. Only my stomach.
okay? So when we rate your pain, sir, so using the pain with the pain scale, so 0 no pain, 5 is moderate, and then 10 is worse. So how would you rate your pain right now? Is it 4 over 10, 5 over 10, 6 over 10? How would you rate?
4/10.
All right. So okay. So what treatment of your pain? What treatment affects your pain? What treatment of your pain affects before? Um,
I take Advil and
Advil tablets. So
Advil tablets, and
okay. So is that you're taking Advil?
yes, ma'am.
Okay. So what do you think your pain getting worse?
It's my stomach is empty, and then if my stomach is full, I get a pain there inside.
So you mean when you did not eat, so you're not eating when you're hungry, so
Yes, yes,
you're experiencing pain.
yes,
At
ma'am,
the
like
same
that.
time, when you eat, when you're full,
Yeah, it's
still
still
experiencing pain. Is
yes,
that
yeah,
what you mean?
yes, ma'am, like
Okay.
that. Yeah.
So what do you think the cause of your pain?
Maybe I'm not sure. Maybe this is a stomach ulcer, or I am not sure right now, ma'am.
Okay.
Yeah,
Mm.
what's inside? Yeah.
Okay, that's okay. Um, by the way, how are you right now?
I am not so good. I am not so bad. Maybe 50-50 because sometimes I experience a pain inside in my stomach. So I'm not totally 100%. I'm good.
All right. Okay. Um, can you still remember my name?
Yes.
So what is my name?
Ivy.
Okay. Do you know where are you right now?
Yes, in Blue Valley Clinic in Calgary.
Okay. So do you know the date today?
Yes, this today is November 24, 2020.
All right. So what did you eat your breakfast this morning?
I eat my breakfast with toasted bread with bacon and fried egg.
All right. So, can you tell me where you were born?
And the Philippines, I am a Filipino.
So, is that your country, Philippines, right?
Right.
Okay. So it seems to me that your mood is not really bad, not really good, not really bad as well. So with affects, then you are alert, coherent, cooperative, and oriented times three as person. You mentioned my name, the place, which is the Calgary, and then the date and the time, which is you mentioned the date today, and your short term and long term memory are intact. So you mentioned what you for the short term. You mentioned your breakfast. What did you eat? And then the country where you were born, which is your long term memory. So the short and the long term memory are intact. So now I'm gonna check your pupils using the pin light. Is that okay?
Yes, ma'am.
All
Please.
right. Okay. Okay. Just using the pin light. All right. So just straight your head here. Don't move your head. So just stay steady your eyes. So I'm gonna start here on your left side. All right.
Okay.
Okay. Other one. All right. So I'm gonna check the your reactions to light. Okay. All right. So can you follow the directions of the pin light? Okay. So start here, going to your nose. Okay. Going to the left. Okay, going to the right. Okay, so your pupils are equal to round, and then reactive to lights, 3 mm diameter, then and light accommodations bilaterally. Then, okay, can you squeeze my hands, please?
Okay.
Squeeze my hands, and then can you put your legs here?
Okay.
Put your legs here. All right. So I'll I'll put my both hands here.
Okay.
Okay. Can you move your feet up above towards you, and then can you move your feet downward, down, down, down. Okay. Your motor functions of your upper extremities and then lower extremities are good and equally bilaterally. So when you grip, when you do dorsiflexions and plantar flexions against resistance. So now I'm gonna check your lungs. That's okay?
Okay, ma'am. Thank you.
Okay. Any experiencing difficulty of breathing?
No.
And then any history of respiratory infections?
No.
Any history of asthma?
No.
Do you smoke?
No.
All right. Can you remove your shirt for me, please, if you don't mind, sir? Okay. Okay. I've noticed that you are a thoracic breather, so your breathing is normal in a regular pattern, inappropriate, in and then is appropriate. I mean, and then I've noticed that you are not using your accessory muscle to breathe, so you are not in respiratory distress. So your thoracic is symmetrical and elliptical in shape. The costal angle is within 90 degrees, which is normal. And then your transverse ratio, the antero-posterior ratio is 1:2, and then there is no barrel chest noted, so which is normal. Okay?
Okay.
So may I take a look your lips, sir? Okay, so your lips is there. I did not notice any bluish discolorations or cyanosis around your lips. So circumrally, sorry, how would circumrally you are not cyanotic. So can I take a look at your fingers? So there's no clubbing notice on your fingers. Is it it's normal. So there's no cyanosis of your both hands, your wrist. So there is no your peripherally no cyanosis noted. All right. So now, I'm gonna palpate your no as auscultate. I mean your lungs sounds. So I will listen to your lung sound. I mean, so I'm gonna auscultate your first your arterial chest, then second is your posterior chest. Can you sit down for me here,
Yes.
please?
Thank you.
Okay, so in auscultations, I'm gonna listen to the above the clavicle. This is the border of the apex of the lungs, going down to the second border, intercostal space, which is the upper board, the upper part, the upper lobes of the lungs. We can hear the sounds. Then the fourth intercostal space, we can hear the right middle lobes of the lungs, and then fifth intercostal space, sixth intercostal space, we can hear the lower lobes of the lungs. So, sir, and every time I put my stethoscope, can you breathe inhale and exhale? So
Okay.
just follow my command, please.
Okay. Thank you.
Tell me if you have any discomfort.
Okay. Sounds good.
Okay. All right. So inhale, exhale. Okay. Inhale, exhale. Okay. Going down to the second intercostal space. Inhale, exhale. Inhale, exhale. So going down to the third intercostal space. Inhale, exhale. All right. Inhale, exhale. So going down to the fourth intercostal space. Inhale, exhale. Okay. Inhale, exhale. Now going down to the fifth intercostal space. Okay. Okay. Inhale, exhale, and then inhale, exhale. Now, can you stand up? I'm gonna
Okay.
auscultate your posterior part.
Okay.
So, can you turn around? All right. So, in the posterior part, I'm gonna locate the C7 down to the T10. So, C7 to T3 is the upper lobes of the lung, and then T3 to the T10 is the posterior lobes of the lung. So the C7 is the bony permanences. So I'm gonna go down to the above the clavicle, not the scapula. I mean, so I'm gonna start as auscultating there. Okay, okay. Inhale, exhale. Okay, inhale, exhale, and then I'm gonna go down and inhale, exhale. Okay, inhale, exhale. In the third intercostal space, inhale, exhale. Then inhale, exhale. Going down to the fourth intercostal space. Inhale, exhale. All right. Inhale, exhale. Going down to the fifth intercostal space. Inhale, exhale. All right. Inhale, exhale. Going down to the sixth intercostal space. Inhale, exhale. Okay. Okay. Inhale, exhale. Going down to the seventh intercostal space. Inhale, exhale. All right, going down. Inhale, exhale for me, please. All right, going to the eighth intercostal space. Inhale, exhale. All right, inhale, exhale. Then going down to the ninth intercostal space. Inhale, exhale, and then the other side. Ninth intercostal space. Inhale, exhales. All right. Upon auscultation, sir, all field of your lungs are clear.
Okay.
So there
Thank
is
you.
no abnormality I heard upon auscultations.
Okay.
Can
Thank
you
you,
sit
ma'am.
down, please?
Thank you, ma'am.
Okay, now I'm gonna proceed to check your heart. Is that okay?
Okay, ma'am. Yeah.
Okay. So any history of chest pain?
No.
Any history of stroke?
No.
Any history of hypertension?
Yes, ma'am.
So you mean you are hypertensive? Hypertensive?
Yes, ma'am.
Are you taking medication on it?
Yes, ma'am.
All right. So can I check your temperature of your upper
Okay.
extremity? Just relax. So I'm gonna use my back of my hands.
Okay.
All right. So I'm just touching like this. Okay. Okay. This is your arm. No, I mean your forearm and then arm. All right. The upper extremities temperatures are warm to touch. Then then the skin is intact, and then the color is uniform in color. I mean bilaterally. Now, can I take a look your fingers again? So I'll check the capillary fill. So it's less than 3 seconds, which is normal, and then there's no edema I've noted. Now I'm gonna palpate your radial pulse. So can you? So this is your radial part, your radial pulse. Okay, yeah, it's very It's yeah. I can hear it's palpitating. Now this is your here. I'm gonna palpate your yeah here. So your this is your brachial pulse. Now I can feel it. Now so upon so your pulses of your upper extremity, where the radial and then the brachial is strong,
Okay.
palpable, regular, and equal bilaterally.
Okay, that's good.
Can I take a look? Can you raise your both legs, please?
Okay.
Okay. So same with same. I'm gonna check the temperature of your legs using my both hands. Okay. Okay, so the temperature is warm to touch. Your skin is intact. There's no color. There's no discoloration of your skin of your lower extremities bilaterally.
Okay.
Now I'm gonna check the capillary refill of your toes. This less than per second, which is normal. There's no edema noted on your ankle. Now I'm gonna check your dorsalis pedis pulses,
Okay.
which is between the big toe and then the middle toe. It's here.
Okay.
Okay. Yeah, I can feel it now. And also your posterior tibialis, which is lateral malleolus. I mean, it's here.
Okay.
All right. So the pulses of your lower extremities, the tibialis posterior, dorsalis pedis is strong, equal, and equal, regular bilaterally. Now I'm gonna auscultate your heart sounds. I mean, sir, is that okay?
Yes,
Can you
ma'am.
sit
Yes.
down here, please?
Okay. Thank you.
Okay. So I'm gonna auscultate your heart sound. So the area is the aortic valve, then the pulmonic, then the mitral, and then the tricuspid. So the first is the aortic valve. This is located in the right second intercostal space, the right side of the sternum. So from the sternal notch going down. So it's here. Then going to the left second intercostal space, which is the pulmonic valve, and then going to the fifth intercostal space, which is the left sternal border, which is the tricuspid valve, and going to the mid-clavicular fifth intercostal space, which is your mitral valve. So now I'm gonna auscultate it now. All right. So for sternal latch, it's here. Okay. Yeah, I can hear the loud dub. All right, the pulmonic valve. Okay, I'm going down to the fifth intercostal space, left sternal border, which is the tricuspid valve, and then going to the center, to the mid-clavicular line, which is your mitral valve. Now, I'm gonna use the bell of the stethoscope to determine if there's bruit or any abnormality. So
Okay.
from sternal, now let's go into the to the second intercostal space, which is aortic. It's here. Yeah, labdab. It's here. Your pulmonic valve going down to the tricuspid valve, and then to the mitral valve, which is the mid-clavicular line of your fifth intercostal space. So that is your mitral valve. All right.
Okay.
Upon auscultations, your S1 and S2 sounds are normal. Then I didn't heard any abnormality, murmurs, or adventitious sounds.
Okay.
All right, sir. So next I'm gonna check your abdomen. Is that okay?
Okay, ma'am.
Can you go back to sit there, sir,
Okay,
please?
thank you.
All right. So, okay, can you sit down, please? All right. So, any difficulty of swallowing when you're eating?
No.
Okay. Any history of gallstone?
No.
All right. History of kidney stone?
No.
History of urinary tract infections?
No.
All right. Any changes of your weight, your appetite?
No.
Okay. So, how much fluid do you intake every day?
8 to 12
Glasses?
glasses of water a day.
Okay. So, good. Wow, that's good. Then, any recent episode of nausea, vomiting, diarrhea?
No.
Okay. So, when was the last time your bowel movement?
Just like a pee like that.
No, your.
This morning. Yeah.
So when was the last time your bowel movement? I mean,
Yes.
so
This morning.
this morning. You mean
Yeah.
you have bowel movement this morning?
Yeah. Yeah.
Okay. All right. So I'm gonna check your oral mucosa. So
Okay.
can you open your mouth? I'm gonna use the pin light. All right.
Okay.
Okay. Can you open your mouth, please? Oh my God. Sorry. All right. Okay. Here. All right. So your mucosa is intact. It's moist and then pinkish. It seems that you are hydrated. So then I will pinch your above your clavicle, the skin of your clavicle, your forearm here. Okay, it's you have instant recall. It seems that you are hydrated. So now I'm gonna check your abdomen. Can you lie down for me,
Okay.
please? Then use your blanket, please. Okay. All right. Are you comfortable?
Yes, ma'am.
Are you okay?
Yes.
So your abdomen contour is round and symmetrical in shape and symmetrical. Then your skin of your abdomen is intact. No bruises, no rashes noted. So I've noticed there are some of your birthmark here, and so there's no mole noted. Now next I'm gonna palpate and I'm gonna auscultate your bowel sensor using the stethoscope. So the sequencer is start in the right lower quadrant, going to the right upper quadrant, going to the left upper quadrant, and then left lower quadrant.
Okay.
So I'm gonna auscultate now.
Okay.
So it's here. Okay. Then going up to the right upper quadrant.
Okay.
Then going to the left upper quadrant. And then going to the left lower quadrant. Okay. So next I'm gonna palpate
Okay.
your abdomen, same sequence. So when I'm palpating, I will look if there's tenderness, there's masses upon palpations. Then at the same time, I will look your eyes
Okay.
upon when I palpating. So can you move a little bit this one down?
Okay.
All right. So is this any pain?
No.
Okay. This is your right lower quadrant. Then here is your upper quadrant, right? Okay. And then your left upper quadrant.
Okay.
Are you okay?
Okay.
Any pain?
No.
So okay, going down to your left lower quadrant. So okay, so your bowel sounds is normal. And then I did not upon palpations. There's no tenderness and masses. When I look at your eyes, your face during palpation, yeah, it's normal. Yeah, I didn't say anything that you are in pain. Okay, so sir, can you sit down for me, please?
Okay.
You can sit down now. So, well, any history of erectile dysfunction?
No.
Is any history of enlargement of your prostate?
No.
All right. So, how many times you void or you pee in a day?
Maybe 8 to 12, something like that.
Okay. Is it normal voiding?
Yeah,
Is
it's
your,
normal
your
to me,
typical
like-
pattern? Okay,
Yeah.
that's good. So, any discomfort that you observe when you voiding?
No.
Okay, so no pain.
No pain.
So no smelly odor,
No.
odor of your pain, your urine.
No.
Okay. So next, sir, can you put this one on,
Okay.
please, your
Thank
shirt.
you.
So the next, I'm gonna check your musculoskeletal system, your muscle or your joints too. So can you stand up? Can you walk? Go on that side,
Okay.
and then come back for me.
Okay.
Just walk slow in normal. Okay. Okay, come back, please. All right. So your ambulations, your gait is steady. You can sit down, sir.
Okay, thank you.
Is steady. Your standing balance is normal, and then when you walk, your arm is swing opposite, which is normal.
Okay.
Okay. Now I'm gonna check your joint your I'm gonna perform the elbow flexions, extensions, and then pronations, and then supinations. So sir, I'm gonna put resistance on your wrist. Can you bend your elbow towards you?
Okay.
Okay, bend, 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 and then opposite, please. Can you straight your elbow, straight, straight, no, straight, opposite, straight, straight. Okay, good. Then can you no, can you put your legs like this? No, bend. No, just bend. Just bend. Okay, I'll put resistance on your knee. Can you
Okay.
bring your knee towards
Okay.
you? Up, 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 up. All right. So the muscle strength, your upper extremity and lower extremity range of motions are within normal limits,
Okay.
and then the muscle strength of your upper extremity and then the lower extremity is good bilaterally. So before I forget, sir, is your by the way, your sleeping pattern, I mean, do you sleep normal? And how many hours do you sleep in the night?
7 to 8 hours a day.
Okay, so do you take do you take sleeping pills to you to help you to?
No.
Okay, so you did not take any pills to let you sleep.
No.
Okay, so sir, that's all. Thank you so much for your cooperations. Really appreciated.
Thank you, ma'am, and you're welcome.
Okay, so before I go, I'm gonna wash my hands and or sanitize my hands, and that's it. That's my head to toe assessment. Have a nice day, everyone, and stay safe.